Okay, good afternoon, everybody. I would like to open our Board of Health meeting for Tuesday, March 15th. With us today are our board members, Jennifer Inferno and Maureen Pimentel, and myself, Kathy Donahue. And what we're doing today is I'm opening the session, but we are going to close it to go into executive session to do Jennifer Murphy's annual review. And then we will come out of that session and then reopen it and go into, I believe, public comment, or then we'll review the minutes. So at this point, I will close the meeting and go into executive session. Great. I'm ready. Okay. Thank you for your patience. So now we are going to open the meeting back up again and call it into session, and then we are going to vote. And so what we're voting on is Jennifer's annual performance review. And we discussed it, and we all feel very comfortable with, I'd like to do a roll call vote to have Jen go from a step 16 to a step 17. And we would also like to add a 2.5 MBO increase. So at this time, I'll take a roll call vote.
Sorry. Oh, motion.
Oh, motion.
So a motion to vote on Jen's performance and salary.
How do we do that?
Second?
Yep, second.
Do we need a third?
No.
All in favor?
All in favor, aye.
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 And then a roll call vote.
And a roll call.
Aye.
Okay, so for Maureen Pimentel, it's aye, and for Jennifer Inferno?
Aye.
And for myself, aye. So the ayes win. And we are very thankful to Jennifer Murphy for all she's done, and to confirm the increased step 16 to 17 and a 2.5 MBO.
Great, thank you.
Thank you.
Okay. So now we are going to move on to the minutes. Have you all had a chance to review the minutes?
So I did review, but I do have some edits that I want to get back to Regina, so if we can just turf this to the next meeting.
Absolutely.
Thank you.
Yep, not a problem.
Also, I do think there was a date.
Yeah, she resent the date incorrect ones, but right as I was walking in, so I think we should all just take a minute to review them, and then we can vote at the next session, if that's okay with everybody.
I think that's okay. Is that okay if I'm not at the next one?
Yes.
Okay, good.
But do you have comments on all of them, Maureen? Yeah. In other words, do you want to table all of them?
No, I guess my only comments were on, so no, December 14th, I'm fine. I have to look at that. Are these the updated dates ones?
No. So the
I can look and see what
shorter
Regina sent.
the shorter December 14th minutes, that should be December 17th.
Right.
Oh.
December 17th. Yes, so December 17th I'm fine with. So if we want to
Okay, so we can approve the minutes
approve the
from
minutes for December 17th?
December 17th. Okay.
Was our budget meeting, Jen?
Yes, and then I was not there for November 8th.
Okay,
So
so
I
you
would
will
abstain
abstain
on that.
from that one.
Yep.
Okay.
Yes, so December 17th and November 8th, I'm fine moving forward with.
Okay.
So if we want to take a motion.
So I'll do a motion to approve the minutes from November 8th and December 17th.
Yep.
And then Jennifer Inferno is going to be abstaining for the minutes on
November 8th.
November 8th. Okay. So I made the motion.
So I second, and I vote yes for November 8th and December 17th.
Okay, as well as I do.
And I vote yes on December 17th.
Perfect.
Perfect. Okay, so that's complete. Okay, so now we move on to public comment. And so I would like to just remind everybody, we're going to allow 15 minutes for public comment and 2 minutes per person. Please please only go one time. And please let us know your address before you speak, and we'll open it to public comment at this time.
No? Great. Did anyone write in? Jen? No? Perfect.
Okay. So we will move on to the next order of business, which is new business, and that would be the director's report.
So real briefly, I wanted to go over just the recent COVID data, which is obviously still updated every Monday on our dashboard. And so as you can see, our numbers are still low. Obviously, these are still official PCR or probable antigens that we report on our dashboard. At-home tests, still, we don't know that number out there. And so we did have a ever so slight uptick in reported cases, official reported cases after the February break, as anticipated.
Yeah.
But it looks like it's coming down slightly, and we expect to see that trend continue. In other words, lower levels, much lower than what we experienced over the holidays. And so our positivity rate, I expect it to decline even further, but as of March 5th, we were at 2.26%, a little bit higher than the state average of 1.86%, the positivity rate of 1.86%. So less people are being tested. The demand on our testing at Town Hall has increased quite a bit, actually. Last week, we did hold a 1-hour session. There were only 15 participants. So that's why we decided to forego it, actually, this week. We will stand up more testing clinics before and after the April vacation break. And that should be, and then we'll decide after that, sort of take it based on demand.
That makes sense.
So that's it for data. Sort of, obviously there's a lot of talk about, subvariants out there and what's going to happen. And, the state isn't actually even talking to us about this right now. So as soon as we start to have a conversation about it being more of sort of a real sort of threat to us, or a new threat we have to keep our eye on, we can start to discuss that and what will happen.
It seems like there's some sewer data that's coming into play again, doesn't?
Yeah, I checked the MWRA website yesterday, and it doesn't seem like there's an uptick of anything to be necessarily concerned about there.
Good.
So
okay.
I was keeping an eye on that as well. So, but we'll see.
Yeah.
And so, as you know, we've scaled back our protocol of how we address positive cases greatly. In fact, our case management team has been disbanded, except for one person that we have kept on staff to address long-term care facilities, people over 65, as well as the people who are unvaccinated. So we still try to impart information to those two groups. But other than that, people largely know where to go for the information. And so one of the questions is...
Jen, is that for close contact tracing, or what are you doing with those two groups exactly?
So it's really less about contact tracing, and it's just more about addressing the positive case themselves.
Yeah.
Tell them what to do. In other words, you need to contact your close contacts. We no longer do that. Yeah.
Okay.
Yeah. So just to make sure people get the information around isolation, which still people should be adhering to if they test positive at home or test positive at a site. They should still be isolating 5 days at minimum, and then masking for days 6 to 10, or staying home if they still feel ill through the 10 days. So, it's people's responsibility to hopefully take this information seriously.
And how easy or not easy is it if there was more cases coming up, if there was some other kind of surge, how easy is it to get more of those people back since they've been disbanded? Is that easy or no?
And I asked that question.
Yeah.
That's a good question, because sometimes we need to turn on a dime.
Yes.
As you know, Maureen, you did it.
I
did. So everyone is willing to return. If we have the need, everyone who is on our case management team is willing to come back and help us. Now, some people have gone on to do other things, obviously, but whatever time they have, they're willing to devote to help us. So it's possible that we may need to recruit others. But I do know that there are still people out there from the CTC, when that was disbanded, the State Contact Tracing Collaborative. So there are people out there who are familiar with how to do the job, so hopefully we'd be able to recruit fairly easily. But I'm not sure if we would have to address it as intensely as we once did. The state seems to think, we need to look to a new model of doing business going forward, and I tend to agree with that. We can't do it to that level of intensity, but we still need to obviously get information out there and keep people safe. So we'll see going forward.
And then just in terms of testing clinics, if we have to convert back to more demand for testing clinics, is it, now that we've done it, a pretty easy setup to sort of bring them back up to speed?
It is, actually.
Okay.
In fact, Stephanie Blass was spearheading our testing clinics, and she has since trained someone on staff that we have, so that that person can actually stand up a clinic whenever we want. So, for example, last week we decided to do just an hour and see how that went, and we were able to do that very easily with the staff we have on in our office.
Perfect.
But obviously we have a whole list of medical folks ready and willing, hopefully, if we need to. So
okay, great.
yeah, and I will be getting you final data for town meeting to report out on, total numbers of vaccinations given out, total numbers of people tested. In fact, it is in my write-up for my review. I don't know if you saw it, but we will be reporting that out to town meeting as well in a more public way.
And one other question on just on vaccinations with the, 12-year-olds just being available for boosters in, the spring. Will we try to do school clinics in the spring or no?
Yeah, so that's a good question. In fact, I was just talking to Karen, our public health nurse, about that, and we need to touch base with the schools again to figure out, do we want to do something at all? Do we want to hold it in school, out of school, on a weekend?
Yeah.
Where and what age groups would we target? So we are going to have a conversation with the schools. As you know, we went into the two elementary schools.
Yep.
And so there were only 14 kids total who took part in that. So demand seems to be, really low. It's waned significantly. But you can see from our data on our website, there's still work to be done with the boosters, I think. So
Yeah, that's more specifically because like my daughter just turned 12 in December, so she was part of the 11-year-old group that couldn't be vaccinated, so she just got done in December. So she'll be due for a booster, sometime May, June. So I just didn't know if that subset of the population that will be available for boosters in that time frame, if we would try to either do the Saturday clinics you did for the 5 to 11-year-olds was great at McCall, or something during school days.
Okay, yeah, we can certainly do that, because I think, that holding vaccination clinics is going to be something we need to continuously do. It's just what sort of format do we want it to take? So we will, I'll report back out to you when we set that up. So any other questions about the data?
No, looks good.
Okay. What else do we have? So for town meeting, I just touched on that. That's April 25th, the first night. And typically, the board chair reports out during the committee updates right at the beginning of town meeting. And so I will coalesce all the data we have from the past year and make sure that that gets to you, whomever may be doing the presentation that night. And I don't know what format town meeting is even going to take, whether it's in person or Zoom, but either way, we can have some slides available to be able to report out relevant data from this past year.
Okay, that's great.
And it also doesn't have to be the chair, by the way. It can just be anyone who's willing to do it.
And what information is usually presented, Jen?
It's just really the highlights, the key things that
Like
we
accomplishments or
correct
decisions or
accomplishments, but it could include policy decisions, things that you voted on policy-wise, regulation-wise. Really, it's you craft it how you see fit, what you want to communicate to the public of what has transpired over the past year. It's really only, I believe, 5 minutes. You can have another 5 minutes, I believe, but 10 minutes would probably be pushing it.
and do all the elected boards report on the same day at town meeting?
Yes.
Yes. So they're hearing like a whole litany of.
Exactly. Which is why it's usually capped.
Yeah.
Town meetings.
We have the opportunity to also present at fall town meeting, but spring it just seems to be the tradition, and it sort of encapsulates everything nicely for a whole year's worth of activities.
Okay.
And our budget, which will be voted on at town meeting, I have packets from the town manager's book. I don't know if it's the same information we had discussed.
December.
Correct, in December, and nothing has changed, but if you wanted to review it or talk about it, happy to do that. If you had any questions about what is going to be voted on at town meeting, we can.
Can we just look at it when we're done?
Yeah, sure.
Nothing's changed since we met in December on the data, right? No. Okay.
So in the, sorry.
Thanks. Yeah.
What about the spending, Jen, in December with the COVID funds? Wasn't that not updated when we met in December?
So this is just in our core budget. It doesn't include
that's separate.
any. Right.
Yeah.
So you won't see ARPA.
Right.
Or CARES.
Got it.
Right. So this is just the bare bones budget.
Got it.
And so the Arpa funding is something that is controlled by the select board, which, as you know, so we went and asked for funds, mostly centered around COVID. this attachment with the yellow highlight is just a breakdown of the professional services line item.
Yep.
But those are, again, nothing's changed. It's the costs and the services associated with those costs that we, that we offer to the public every year.
And then a breakdown of the ARPA spending, that is not here, but is that something that eventually will be available?
Yes, I have an Excel spreadsheet I could forward to you of all of our expenses to date and on what, but it was the items that we had talked about earlier.
Yeah.
It was, the testing for our case managers,
Yep.
so staff, testing and so forth. So nothing about that has changed,
Okay.
but only in that we're spending less of it,
That's-
right?
yeah.
Yeah. So.
Than what we initially asked for.
Correct. And that money doesn't roll over into the general fund like our budget would. In other words, unspent funds will remain in ARPA.
Yep.
So we would have access to that should we need, because it is COVID money. So if there's
Yeah.
a spike or we need to respond in some other way, the money will be there for us to tap into even beyond the end of this fiscal year.
Right. Okay. Great.
I will forward you the Excel sheet.
Great.
Yeah.
Yeah, that'd be great.
Okay, and just a note on some events that we have coming up. These are our yearly events, actually twice yearly events. We have the Medication Take Back Day, which Doc Butler spearheads with the police department, and that is on April 30th. And then we have Household Hazardous Waste Collection Day that we work with the DPW on, and that's on May 7th, Saturday, May 7th. And so those are already planned. We can start promoting fairly soon to get the word out there. And one other item I just wanted to mention. Kathy, I know you thought this was your last meeting. However, I may need to have a...
That's okay.
Just when you thought you were out.
Yeah, right. So before Saturday, it is possible that I may need to convene, and we could perhaps do it by Zoom. It would... and it may need to be on an emergency basis, depending on how the situation goes. But there's a home that is that I may need to condemn, a residential home.
Okay.
And so water has been completely shut off to the home, and so therefore it meets the criteria for condemnation. And so there would be, in order to vacate associated with that.
Yes.
In the housing code, what happens is that I can condemn a home based on an emergency basis, which I will do. And then I need you to ratify that action. So in other words, normally when you condemn a home, if it's not an emergency, I would come to you and ask that you vote to condemn a particular property first. But in this case of an emergency, my action will happen tomorrow. I just didn't have the legal documents teed up for you to ratify that tonight.
Okay. No problem. We can be available.
Yep.
Obviously, whatever you
No
need.
problem.
All right, great. So that is all I have, actually.
Okay.
All right.
Does anybody have anything else?
No, it's nice to have a nice, quiet meeting.
It sure is. Yeah. So I think,
I'd just like to say, if we don't have another meeting, thank you, Kathy, for all your work.
thank you very much.
A lot of work over the past few years, and
Thank
you'll
you.
be missed.
Thank you very much. I will
And-
miss you guys as well. No
And I
question.
wish I could have worked with you longer, but it's been great.
Thank you. Thank you.
Yeah, and I do have to publicly thank you as well, Kathy, because you have been an incredible ally to our department and to me, because this has been a pretty wild and challenging past 2+ years. And so I really appreciate you either just letting me vent or offering me sound advice, and I thank you very
Thank you.
much. It's been a pleasure working with you.
Same. Thank you very much. It's been my pleasure. So on that note, we will close the meeting. And we will then reconvene if we need to later in the week, but at this
Do
time,
we want to pick another date?
yes, I always forget to do that.
Well, you'll have more different board
You'll have
members.
Yes, so
Potentially.
so how do you want to do that?
So my only thought was if somebody has to present at town meeting on the 25th.
Right. So we would have to meet right after election to reorganize anyway. So we can, do you want to pick a date next week tentatively based on people's schedules? Maureen, it's,
Your schedule?
you hold the cards.
I think it's on your schedule.
Yeah, I'm perfectly happy. Do we have to set it right now? Because in my mind,
No, you don't.
asking the candidates when they're available seems the fairest way to
Yes.
do it.
I would do that.
So if we don't have to set a date, let's just leave it open, and then whatever happens this weekend, we can reorganize and set a date for next week to reorganize or something, once we talk to everybody involved.
Good.
That sounds great.
Okay,
So we'll abstain from
Now
doing
you
that today.
now you can
So
vote
now
to
officially, I will close the meeting for Tuesday, March 15th. Thank you, everybody.
Do we need to vote or no?
We need to vote.
Yes, to close the meeting, right?
Oh, vote to close the meeting. Sorry. So let's do a roll call vote to close the meeting. Jennifer Inferno, what do you say?
Aye.
Maureen?
Pimentel, aye.
Kathy Donahue? Aye. Thank you.
Thank
Good night.
you all.
Thank you.
Good night, guys.